Hello everybody, my name is Diana Soto. I am a senior through Indiana State University's LPN and BSN program. Today I'll be talking about the disorder called pre-eclampsia. Some of the learning objectives are the following. So the first one is I would like the audience to learn and be able to explain what is pre-eclampsia. The second one is the audience will know what is an abnormal blood pressure. Third, the audience will be able to identify symptoms of preeclampsia. 4, the audience will identify risk factors of preeclampsia. And 5, the audience will be able to identify healthy lifestyle changes when diagnosed with preeclampsia. Before we begin the lecture, be sure to click the link below to start the pretest. What is preeclampsia? Preeclampsia is a hypertensive disorder in pregnancy that occurs around 20 weeks of gestation. There's either a slow or a sudden increase in blood pressure to the mother of a reading over 140/90. This reading must be collected on 2 different occasions and at least 4 to 6 hours apart. Preeclampsia is very dangerous because it can cause a lot of organ damage to areas in the mother like the brain, kidney, and liver. The placenta is very important for the fetus because this is what delivers the nutrients, the oxygen, and all the blood flow to the fetus. When the blood pressure is high in the mother, it reduces all the blood flow, the nutrients, and the oxygen to the fetus, which can cause the baby to be born with a low birth weight or have other health problems. In severe cases, the baby may unfortunately be born as a stillborn. Some symptoms to be aware of with preeclampsia are the following: severe headache, vision loss, blurriness or change in light sensitivity, nausea, vomiting, decreased urine output, swelling of the face, eyes, upper and lower extremities, upper right quadrant abdominal pain, and shortness of breath. The following are some risk factors of preeclampsia. The first is having a history of preeclampsia. The second is dependent on the mother's age, so anyone younger than 18 years of age or older than 35 years of age are at risk for preeclampsia. Obesity, race. African Americans typically have a higher risk of developing preeclampsia. Mothers with multiple pregnancies, meaning do they have twins, triplets, etc. A mother with a history of diabetes, kidney disease, lupus, chronic high blood pressure, or some other risk factors. And then also the intervals between pregnancies. Now you may wonder, how would your doctor diagnose you with preeclampsia? First, like I said previously, 2 blood pressure readings greater than 140/90 that are at least 4 to 6 hours apart on 2 separate occasions are one indication of possibly developing preeclampsia. Another major diagnostic test is a urine test. So usually when your kidneys are working properly, you are filtering all the waste products in your body, and the kidney will filter through what they want to keep and what they want to get rid of. When the kidneys are damaged, they tend to leak, and something that can leak from your kidneys is protein. And that protein would be seen excreted in your urine. So when the doctor does dip, or when the nurse dips your urine, typically with every OB appointment, one thing they check for is protein and glucose. And the protein is indicative of hypertension. It can be from 0 to 4 plus. Anything greater than 1 plus is an indication that you could be developing preeclampsia. Another is a blood test. So the blood test is something that the doctor might draw to assess how you're doing. So a CBC is a complete blood count, which measures how many red blood cells you have in your blood. And it also does a platelet count to see how your blood is clotting. This is very important because it'll help examine your kidney and your liver function. A next diagnostic test is a creatinine test. So if you came out positive, at least 1+ or more, in that urine test that I talked about previously, your doctor most likely will have you do a 24-hour urine collection. So what you do is first thing in the morning, usually you'll urinate in the toilet, let that first one pass. After that, for a full 24 hours, anytime you urinate, you're going to urinate in a hat and collect it in a little container that the lab will give you. Throughout the day, you'll urinate and then pour the urine in there. Make sure to keep that urine in the refrigerator. And after that 24 hours, you would deliver it to your doctor's office or the lab, wherever they tell you to deliver it. The reading in that to indicate preeclampsia is if your urine shows over 300 milligrams of creatinine. That's usually indicative of preeclampsia. Or your doctor may do a urine creatinine protein ratio, and anything over 0.3 milligrams will show that you are possibly in preeclampsia. The following are some complications of preeclampsia. So the first one is fetal growth restriction. So like I had talked about before, the baby is not getting enough nutrients or oxygen due to the poorly flow of blood through the placenta. So the baby's growth may be restricted. The second is preterm birth. Due to the mother's hypertensive disorder, she may have to deliver early because the only way to correct preeclampsia when it's gotten really bad and not controlled with medication is to deliver the baby and to deliver the placenta. The third is placental abruption. So this can occur again with severe preeclampsia or eclampsia. The placenta would detach from the uterus, causing the mother to have a lot of brisk red vaginal bleeding. And this would be painless to the mother, but it's very dangerous. The mother can be affected as well as the baby and could even lead to death. Eclampsia is the next form of preeclampsia. So preeclampsia is the first stage of this hypertensive disorder, and when it gets to a severe stage, it is now called eclampsia. Like I said before, organ damage as well. So you may see organ damage to the brain, to the liver, and to the kidneys. HELLP syndrome is something that can happen to the mother as well. So it's hemolysis of the red blood cells, elevated liver enzymes, and low platelet levels. So this can be all dangerous to the mother and the baby. Can cause the mother to go into a DIC, causing uncontrollable bleeding and clotting. So what is eclampsia? I did mention this briefly in the previous slide. However, I wanted to talk about it more because it is directly related to preeclampsia. So eclampsia is a severe complication of preeclampsia. In this state, seizures can occur to the mother due to the central nervous system's irritability. They may have they're going to have hypertension, but they may have headache, vision changes, and notice hyperreflexia in the mother. You may notice a deep tendon reflex at a 4+, so they would be really reactive. If you flex the foot, it would be bouncing back and forth pretty rapidly. So you may notice decreased level of consciousness as well and agitation in the mother. It's important to note this can also occur postpartum, so it's important to be aware of the mother 48 hours after delivery because it's still likely to occur. Magnesium sulfate would be given to the mother at this stage to help prevent seizures. Some things the mother should be aware of when they're diagnosed with preeclampsia is they should be able to check their blood pressure at home and understand what is a high reading. They should know symptoms to look out for weight gain, and to also increase some protein into their diet. On this slide, I have a couple of references for you from ACOG to go ahead and find out a little bit more about blood pressure and how to control this. Thank you for watching my presentation. Be sure to take the post test that is located below the video.